Hello and welcome to DMA Healthy channel. In this video, we will look at calcium and vitamin D deficiency, symptoms. In spite, symptoms deficiency are similar for both vitamin D and calcium, as they work together in the body. However, little differences exist. That's why, we will go deeper in this video. Vitamin D is a fat-soluble vitamin that plays a role in many important body functions. It is an extremely important vitamin that has powerful effects on several systems throughout your body. It is best known for working with calcium in your body to help build and maintain healthy bones. It is also involved in regulating the immune system and cells where it may help prevent cancer. The satisfactory utilization of vitamin D not only safeguards the bone and immune system of the body, but it is responsible for preventing various serious health threats. Research suggests that vitamin D may play a role in both the prevention and treatment of hypertension type 1 and type 2 diabetes, multiple sclerosis and hypertension. Unlike other vitamins, vitamin D functions like a hormone, and every single cell in your body has a receptor for it. Your body makes it from cholesterol when your skin is exposed to sunlight. It's also found in certain foods such as fatty fish and fortified dairy products, though it's very difficult to get enough from diet alone. Vitamin D deficiency is very common. It is estimated that about 1 billion people worldwide have low levels of the vitamin in their blood. The symptoms of vitamin D deficiency are very similar to a calcium deficiency. Not having enough vitamin D could cause deficiency in calcium because one of the functions of vitamin D is to increase the absorption of calcium by 20x. In following, we will go through 8 signs and symptoms of vitamin D deficiency. Number 1. Getting sick or infected often. One of vitamin D's most important roles is keeping your immune system strong so you are able to fight off viruses and bacteria that cause illness. It directly interacts with the cells that are responsible for fighting infection. If you often become sick, especially with colds or the flu, low vitamin D levels may be a contributing factor. Several studies have shown a link between a deficiency and respiratory tract infections like colds, bronchitis and pneumonia. Number 2. Fatigue and tiredness. Feeling tired can have many causes, and vitamin D deficiency may be one of them. Case studies have shown that very low blood levels can cause fatigue that has a severe negative effect on quality of life. Excessive fatigue and tiredness may be a sign of vitamin D deficiency. Taking supplements may help improve energy levels. Number 3. Bone and back pain. Vitamin D improves your bodies to absorb calcium. Bone pain and lower back pain may be signs of inadequate vitamin D levels in the blood. Large observational studies have found a relationship between a deficiency and chronic lower back pain. In one study, people with vitamin D deficiency were nearly twice as likely to experience bone pain in their legs, ribs or joints compared to those with blood levels in the normal range. Number 4. Depression. A depressed mood may also be a sign of vitamin D deficiency. In one analysis, 65% of the observational studies found the relationship between low blood levels and depression. Some controlled studies have shown that giving vitamin D to people who are deficient helps improve depression, including seasonal depression that occurs during the colder months. Number 5. Impaired wound healing. Slow healing of wounds after surgery or injury may be a sign that your vitamin D levels are too low. Results from a test tube study suggest that the vitamin increases the production of compounds that are crucial for forming new skin as part of the wound healing process. One study on people who had dental surgery found that certain aspects of healing were compromised by vitamin D deficiency. It's also been suggested that vitamin D's role in controlling inflammation and fighting infection is important for proper healing. Number 6. Bone loss. Vitamin D plays a crucial role in calcium absorption and bone metabolism. Many older people who are diagnosed with bone loss believe they need to take more calcium. However, they may be deficient in vitamin D as well. Low bone mineral density is an indication that your bones have lost calcium and other minerals. This places older adults, especially women, at an increased risk of fractures. In a large observational study in more than 1,100 middle-aged women in menopause or post-menopause, researchers found a strong link between low vitamin D levels and low bone mineral density. Regardless of these findings, adequate vitamin D intake and maintaining blood levels within the optimal range may be a good strategy for protecting bone mass and reducing fracture risk. Number 7. Hair loss. Hair loss is often attributed to stress, which is certainly a common cause. However, when hair loss is severe, it may be the result of a disease or nutrient deficiency. Hair loss in women has been linked to low vitamin D levels. Alopecia areata is an autoimmune disease characterized by severe hair loss from the head and other parts of the body. It's associated with rickets, which is a disease that causes soft bones in children due to vitamin D deficiency. Low vitamin D levels are linked to alopecia areata and may be a risk factor for developing the disease. Muscle ache. Muscle pain. The causes of muscle pain are often difficult to pinpoint. There is some evidence that vitamin D deficiency may be a potential cause of muscle pain in children and adults. The vitamin D receptor is present in nerve cells called nociceptors, which sense pain. One study in rats showed that a deficiency led to pain and sensitivity due to stimulation of nociceptors in muscles. Studies have found that taking high-dose vitamin D supplements may reduce various types of pain in people who are deficient. Vitamin D deficiency is incredibly common and most people are unaware of it. That is because the symptoms are often subtle and non-specific, meaning that it is hard to know if low vitamin D levels or something else causes them. If you think you may have a deficiency, it is important that you speak to your doctor and get your blood levels measured. Fortunately, a vitamin D deficiency is usually easy to fix. You can either increase your sun exposure, eat more vitamin D-rich foods, such as fatty fish or fortified dairy products. Fixing your deficiency is simple, easy and can have big benefits for your health. Thanks for listening. Like and comments is much appreciated. Remember to subscribe and tap the bell for more healthy videos.